Good afternoon, everybody. I'm Dr. Neha Dhacholia, family medicine physician from Siu Ka Pha Multispeciality Hospital. Today, I'm here to speak about mental health and its impact on our lives. So, I would like to begin with, what do you mean by mental health? Why are we discussing mental health here today? So, mental health is nothing but what we feel, how we think, and how we behave. So, our thoughts, our behavior, and our feelings, these define our mental health. And the importance of this is it helps in structuring our day to day lives, it helps us in dealing with our routines and responsibilities, it helps us in communicating with others, in uh, fulfilling our roles in a society. So basically, it is overall so important for a physical well-being also. So mental health is not just an absence of a mental disorder. It is more than that. It also involves uh, talking to your colleagues, talking to people surrounded in your family, talking to people who you might think need your help. So, because as physicians, we see such patients every day and we know how it impacts our physical well being, also, it is very important. So, stress, anxiety, depression, everybody knows how all this is important and how we deal with it. Why we are talking about this here is again the impact of when mental health is so significant that today in India there are the suicide rates are very high. The disability adjusted life years, the numbers are very scary. So the recent data that has come up is showing us there are 21 people in 1 lakh uh, per population uh, who are suicidal. So this is a huge number considering the population of our country, and so important again. Why we are discussing it? How mental health affects our day-to-day life? How it affects us? Let us discuss that first. So there are certain risk factors involved. Risk factors, as in, so there is socioeconomic pressure, there is societal pressure, there is social stigma related to mental health disorders, there are gender inequalities, there is social discrimination, there are family dynamics, there are biological factors. Some diseases, some mental health diseases are genetic, and there is also a lack of awareness. The most important thing, there is a huge lack of awareness in people wanting to discuss about mental health and its impact on us. Plus, there is also obviously rapid urbanization. There is a huge migration of people coming from the rural areas to the two tier, three tier country states, which is affecting how we deal with the society, how we deal with the socio-economic burden, and all of this are risk factors to mental health, to mental health diseases. I would not go deep into how what mental disorders are, because that would be very clinical. But yes, I would like to, in short, help you understand what are there are certain warning signs which make you understand who could be a mental health patient. So there are signs like somebody who is eating too much or too little, somebody who's sleeping too much or too little, somebody who's enjoying suddenly stops enjoying doing things that he used to enjoy earlier, somebody who is not being able to fulfill his day-to-day life activities, somebody who is maybe not being as open as he used to. There is a sudden change in behavior that you see. Someone who has discussed self harm or harming others with you, somebody who is violent, aggressive suddenly. So all these are certain warning signs which gives you an idea that this person involved might be at risk for a mental health disorder. So, what is it that you can do? First, let's discuss what is it you can do for yourself. Because once you are healthy, once you are at a good place mentally, only then you will be able to help others. So there are certain things everybody knows. when we talk about a good nutritious meal, why is it important? Because there are certain simple lack of vitamins that cause these mental disorders. A balanced diet, a balanced body, in the sense some kind of physical activity, exercise in your day-to-day life, some positive mindfulness, which involves meditation, which involves taking part in societal gatherings, social gatherings, something that helps you pursue your hobbies. So these are certain things. A good sleep is very important to maintain your mental health. And then there are also certain diseases that require, of course, medication. So you have to reach that point. For that, you need to understand and be aware of what is the problem within. And now we come to helping others. How you can help others, how you can identify. Like I said, the warning signs involved. If you find anybody, showing symptoms or signs of mental health disorders, you should always encourage them to speak, learn to listen, learn to speak, help them express themselves, ask them to seek professional help whenever there is required. There is no need of a stigma to be attached to mental health disorders. There should be, of course, what you can do also is help reduce the burden of others in any way that you can. It could be people in your, people in your family, people you work with, people who are working under you. In any way, if you could reduce their burden. So helping others, these are just basic moral science teachings that we can do. And so I would lastly just like to conclude with one takeaway message from this whole speech is that, first of all, be aware of what a mental health disorder is, what it could mean to you, what it could mean to people who you love or who are around you. Learn to be aware of the signs involved, learn to take help, and learn to give help when it is needed. So that's all I think. Yeah. Thank you.